Sarcoma is a general term for a broad group of cancers that begin in the bones and in the soft tissues. Bone sarcomas are rare tumors approximating 0.2% of all cancers. The common subtypes identified in India include Ewing sarcoma and synovial sarcoma. Soft tissue sarcoma forms in the tissues that connect, support, and surround other body structures. This includes muscle fat, body blood vessels, nerves, tendons, and the lining of the joints. It has an average 2.1% frequency rates in males and 1.2% in females. As Sarcoma Awareness Day is observed every year on July 21st, we at Medicircle are conducting an exclusive series to raise awareness about this rare medical condition. Hi, this is Sana Khan, and today in this initiative, we are going to speak to Dr. Prem Verma. Dr. Prem Verma is a medical oncologist at Ewing Cancer Research Center. He was the first medical oncologist to have worked in Calicut and is currently managing the hematological malignancies and sarcoma unit at the Cochin Cancer Research Center. His major research interests lies in understanding resistance mechanism to chemotherapy and novel targeted therapies. He has been an active member of the Cancer Control Program of the Ministry of Health, Kingdom of Bahrain previously. He is a member of the European Society of Medical Oncology and American Society of Clinical Oncology. Please welcome him to Medicircle. Hello, Dr. Prem, how are you?
Very well, thank you. Thanks for inviting me.
It would be a pleasure, sir. So, Dr. Prem, to begin with, sarcoma is a very rare form of disease. Please tell us more about it. What is it? What is sarcoma?
The sarcoma is a rare disease, and because of that, it becomes a very complicated issue while managing sarcomas. The most common ones, as you mentioned, are the soft tissue sarcomas. And the most common of the soft tissue sarcomas are the liposarcomas, which arise from fat. So it's quite common. We can say the cause of sarcomas are usually following radiation, especially for breast cancer and lymphomas and so on. Like even cervical cancers, ovarian cancers, all of them following treatment have a high susceptibility of getting sarcomas.
Right.
So these sarcomas are essentially highly brought on by genetic modifications. Genetic modifications like includes translocations, amplifications of genes, all of them cause sarcomas. And because of its rarity, and because there are not many signs and symptoms associated with the disease, it's not common to see sarcomas which are, very localized. Most of the time they spread tissues. That's the scenario we see in India.
Okay, so Dr. Prem, how can one detect sarcoma at an early stage? And as you mentioned, they have a very rare signs and symptoms. Can you please let the viewers know what are the signs and symptoms of it?
I can give you a small example of I had a patient with a 48-year-old lady who came with intermittent bleeding, intermittent vaginal bleeding, which was quite difficult for her. And she was evaluated and was found to have something called fibroids, myoma, we say. And but the bleeding stopped. But despite that, she was having problems with further bleeding. And so surgery was planned. And what was taken out were just, it looked like benign in the sense, not malignant or not cancerous tumor.
Okay.
And that looked very, just like very, it was not cancerous at all. And so she was again followed up, and there was a dominant lesion. And that was after around 3 years due to uncontrolled bleeding. The uterus itself was removed, and this particular tumor was found to be a sarcoma.
Okay.
And she had no other problems, no hypertension, no diabetes, nothing. And we don't even have blood tests to diagnose a sarcoma.
Right.
And then, so this is the problem we have. We really don't know. Once you see something, quite many gynecologists would just leave her if she has completed her family, especially when she was 48 years old. She has completed her family. So they would just say that, okay, we have done the DNC procedure, so you can just go home and, we'll follow you up if you don't want to get, your uterus removed. So this actually causes problems, especially when nobody is thinking of a sarcoma. So after some time, the lady would come with metastasis to different parts. Metastasis means spread to different parts of the body.
Right.
So that is the problem we face with sarcomas. They look benign, but then they grow fast. They're growing fast. So unless we keep on watching the particular lesion, or lesion in the sense the particular swelling or whatever, we will not be able to diagnose sarcoma early. It's very difficult.
Okay, so doctor, is there any cure for sarcoma, and how can one deal with it?
Sarcoma, as it is, we need very sophisticated diagnostic armamentarium to actually diagnose sarcoma as of a particular type.
Right.
And there are even variations from one pathology lab to the other. And there are some sarcomas which are sensitive to treatment, some which are resistant to treatment. So we need to differentiate between the two. And so this is where we stand actually with sarcomas. We can treat it, but we need to get a hold of what it is. What is there? There are 70 different types of sarcomas.
Okay.
And unless we know what it is, we will not be able to deal with it. And we do have cures for sarcoma.
Right. So I think it is in the hands of the patient as well to understand their own body, to diagnose their own problem and come with it to the doctor immediately, rather than ignoring it and taking it any such issues for granted, right? So
yes, absolutely.
Right. So Dr. Prem, what is your advice to all those patients who are battling with it, who are currently battling with sarcoma?
It is definitely a difficult disease, but my message would be mainly to the stakeholders in sarcoma cancer care, because in Europe and in USA, they have sarcoma cancer specific centers, or sarcoma excellent centers where you can get the best treatment for sarcoma. Whereas in Asia, and to be very precise, Brazil is the only country in the world where they have the best sarcoma treatment. And if you need to get good sarcoma treatment, there should be sarcoma surveillance networks, and there should be appropriate referral to these programs, and medical professionals should be more trained to detect sarcoma or even to suspect that it is a sarcoma. Without these things, we will not be able to diagnose it on time. So even if a patient has sarcoma, they can battle the disease by getting appropriate treatment at the appropriate time. And even if a doctor gives, it's not right to give time as to when, till what time they will be living, because all that is not in the doctor's hands alone. The patient can always, the patient should have a good lifestyle, because lifestyle management is cornerstone to sarcoma management as well.
Right. So what you suggest is that every patient should be really careful with their life and their lifestyle, the way they live, what they eat, the fitness that they need to take care of. Right.
Absolutely.
Right. Thank you so much, Dr. Prem.
Governments should.
Yes, please. Sorry.
Thank you very much.
You can please go ahead.
Even governments, the Ministry of Health, and all of them, they are all stakeholders in sarcoma care. And there must be proper sarcoma policy making, without which we will be losing many patients to the disease.
Correct. So what you mean is some proper guidelines and policies should be provided to the patients, so we can go ahead with the treatments.
Absolutely.
Right.
Yes.
Correct. Thank you so much, Dr. Prem, for coming to our show, sharing your valuable time and insights with us and our viewers today. It has been a pleasure having you on the show.
Thank you very much.